Sick day guidelines in diabetic patients. When you have diabetes, taking care of yourself during an illness has extra importance, even if the condition is as common as a flu or a urinary tract infection. To avoid complications, it's a good idea to plan ahead for how you will handle sick days, illnesses, and infections. When you get sick, the illness and stress from it causes your body to release hormones that raises the blood sugar levels, making it harder to keep your blood sugar in your target range. Firstly, you must understand why your blood sugar goes up when you're sick. Your blood sugar rises when you're sick because the body secretes a variety of hormones and other substances in the process of fighting infection that either raise blood sugar directly or makes the body resistant to the actions of insulin. Cortisol is the main stress hormone in the body. It makes the body more resistant to insulin action. Other hormones like adrenaline will cause the liver to release glucose directly into the bloodstream. Today, I'll just highlight on few really important guidelines that you should follow when you're sick or while you're traveling or when you're at work, etc. Check your blood sugar levels at least thrice daily. Do not skip your medications or insulin even if you are sick. Drink plenty of water, at least 1 cup or 8 ounces every hour. If you can't eat your regular quantity of food, try eating or drinking in small quantities at frequent intervals. You must consult your doctor immediately if you find your blood sugars are very much elevated, even though you have taken your regular medications, or if you find your urine or blood ketone levels above normal, or if you have repeated bouts of vomiting or loose stools, or if you have high fever and difficulty in breathing, or if you are feeling extremely drowsy or dehydrated. For type 1 school going children, parents should make sure that they eat well and take their regular insulin before going to school. Parents should inform the teachers at school about keeping an eye on the child and observing signs of low blood sugar in them. Parents should keep snacks ready for them in their lunchbox in case of hypoglycemic spell at school hours. Diabetic patients should be extremely careful while you're on a holiday or traveling outside. During this time, try to follow a healthy eating pattern as much as possible while you eat out. If you are constantly driving on a long trip, check your blood sugar levels before driving and also at intervals. Do not skip your meal while driving. Avoid night driving as far as possible. Always carry your medicines and a snack in the car so that you can reach out to them immediately when you find symptoms of hypoglycemia. Limit your alcohol intake during vacation and make sure to eat something while you drink alcohol to prevent hypoglycemia. Always carry enough or extra medications while you travel outside the country to make sure that you don't run short of your medicine stock. You will probably be walking more while on vacation. Hence, always carry a comfortable, well-fitting shoe to avoid shoe bite and injury to foot. Always carry your medicine prescription and also an ID card that says you are diabetic in your wallet. For those patients who travel by air, you must take a letter from your doctor listing all the medicines and devices that you may need in flight. Always carry your medications in your cabin baggage. For those patients using insulin pumps, you must ask airport security to check by hand because X-ray machines can damage the pump. While in the plane, make sure you get up from your seat and walk around when possible to avoid deep vein thrombosis. Take a special insulated bag to carry your insulin to keep it from freezing or getting too hot. In diabetic pregnant women, keeping blood glucose levels near normal before and during pregnancy helps protect both the mother and the baby. If you're pregnant and if you have diabetes, see your doctor right away and take steps to control sugars as early as possible. Avoid alcoholic beverages, smoking, and usage of harmful drugs during the pregnancy period. Follow a healthy eating pattern. Every diabetic patient should always have a sick day kit comprising of a glucometer, supplies for insulin or continuous glucose monitoring system, ketone test strips, sufficient supply of regular medications, glucose tabs, etc.